In recent years, lung cancer has become the leading cause of cancer deaths worldwide. Each year in the United States alone, over 170,000 people are diagnosed with the disease. While men are at greater risk of developing lung cancer, the number of cases in women is steadily increasing. The two most prevalent forms of lung cancer are non-small cell lung cancer and small cell lung cancer. Non-small cell lung cancer is more widespread than small cell lung cancer and accounts for 75% of all lung cancers. Small cell lung cancer represents 20% of all lung cancer cases. There are three main types of non-small cell lung cancer: adenocarcinoma, large cell carcinoma, and squamous cell carcinoma. The most common form is adenocarcinoma, accounting for 40% of all non-small cell lung cancers. Adenocarcinoma stems from abnormal growth of cells that lines the alveoli. Large cell carcinoma is the least common form of non-small cell lung cancer and develops in a number of different types of large cells. Squamous cell carcinoma, which accounts for 15 to 25% of non-small cell lung cancer cases, and is also known as epidermoid carcinoma, begins in the thin, flat squamous cells. Diagnoses of these non-small cell lung cancers depend on the type of cancer cells that are present in the tumor, as well as the different manners in which the cancer metastasizes or spreads and grows. Less common non-small cell lung cancers are carcinoid tumor, pleomorphic, and salivary gland carcinoma. Another form of lung cancer, mesothelioma, affects the pleural lining that surrounds the lungs. Mesothelioma, which is directly related to asbestos exposure, is extremely rare. Only 2,000 to 3,000 new cases are diagnosed annually in the U.S. Asbestos-related lung cancers that are not mesothelioma are usually small cell lung cancer. While lung cancer is often thought of as a smoker's disease, smoking is not its only cause. There are a number of risks that may cause lung cancer, among those being age, smoking, and exposure to asbestos, radon, or chemical agents such as Agent Orange or depleted uranium. Age. The likelihood of developing lung cancer increases with age. Few people under the age of 40 are diagnosed. In fact, most lung cancer diagnoses occur in people who are 45 or older, with a large number of those being 65 or older. Asbestos-related cancers have a long latency period, so most people aren't diagnosed until 20 to 40 years or more after exposure. Smoking. Smoking is the most obvious risk of lung cancer. In short, the more cigarettes a person smokes, the more likely their chance is to develop lung cancer. Longtime smokers who stop smoking, however, can reduce their chance of developing the disease. Some non-smokers can even develop the disease through second-hand exposure. Asbestos exposure. Workers involved in manufacturing, milling, mining, or the installation and handling of asbestos products over long periods of time have the greatest risk of developing asbestos-related lung cancers. U.S. military personnel and shipyard workers, especially those who served in the Navy during World War II, are also at risk because of a high rate of exposure while they constructed battleships. People who have been exposed to asbestos are also at high risk of developing asbestosis, a chronic condition that causes restricted breathing due to benign plaque scarring of the lungs. Having asbestosis, however, increases one's chance of developing lung cancer. Chemicals and gases. After smoking, radon is the second leading cause of lung cancer in the U.S. Radon is a clear, odorless, naturally occurring gas that is in rocks and soil. Many people who develop lung cancer from radon were exposed to it in their homes. Each year, more than 20,000 people die of radon-related lung cancer. Chemicals such as depleted uranium and Agent Orange also cause lung cancer, but these cases tend to be rare and are usually limited to people who served in the U.S. military. Agent Orange is an herbicide that was used in Vietnam to kill vegetation and expose the enemy. Soldiers in the Persian Gulf War were exposed to depleted uranium by coming into contact with it in tanks and vehicles, or by coming into contact with vehicles or bunkers that were hit by depleted uranium munitions. Lung cancer patients' prognosis depend on how advanced their cancer is, how or if it has metastasized, and their age and general overall health. Common lung cancer treatments include chemotherapy, radiotherapy, or surgery. Some aggressive treatments include a combination of all three. Early stages of lung cancer typically do not have severe symptoms, and the symptoms that are present are often similar to those of other common illnesses. Patients are sometimes mistakenly treated for other ailments while there's a more serious underlying problem. Typical lung cancer symptoms include chest pain, cough or coughing up blood, fatigue, hoarseness, neck and face swelling, persistent chest, shoulder, or back pain that worsens with deep breaths, repeated bouts of bronchitis or pneumonia, shortness of breath, and weight loss. Since these symptoms are similar to those of other diseases, it is necessary for a patient to see a doctor to determine the exact cause. The doctor likely will ask the patient many questions about his or her medical history, including questions about smoking and asbestos or chemical exposure. Once diagnosed, the cancer will be staged and a treatment plan will be administered. Lung cancer staging is a determination of how advanced the cancer is. While a number of variables are taken into consideration when staging the disease, the most important factor is whether or not the tumor has metastasized. Small cell lung cancer and non-small cell lung cancer, however, are staged differently from one another. Small cell lung cancer has just two stages, limited disease and extensive disease. Because this type of cancer often spreads beyond the lung very early. In most instances, small cell lung cancers are treated as advanced cancers even if there is no evidence that the cancer has spread. Limited disease refers to the cancer being contained to only one lung, in nearby lymph nodes or in the pleural fluid surrounding the lungs. Extensive disease indicates that the cancer has spread to other parts of the body outside the chest area. Unlike small cell lung cancer, non-small cell lung cancer is divided into 4 different stages. This is common among other cancers as well. The more progressed the cancer has gotten, the higher the stage rating. In stage 1, the cancer is a relatively small tumor with no involvement of the lymph nodes and no metastasis. In stage 2, the cancer has moved into the pulmonary hilar or bronchial lymph nodes, but it has not spread beyond the lungs. In stage 3, the cancer has spread to tissues in the chest and/or invaded lymph nodes in the mediastinum, but has not yet fully spread through the body. Finally, at stage 4, the cancer has metastasized. It has spread outside the chest cavity and can be anywhere, the liver or even the brain. Currently, there are 3 staging systems used for mesothelioma: the TNM, Bouchard systems, and the Brigham system. The TNM system, which is the most widely used, focuses on how much the cancer has spread, the size of the tumor, and lymph node analysis. The Bouchard system, which is much older than the TNM, focuses exclusively on the mass of the primary tumor. The Brigham staging system allows for 4 stages, and it is based on whether the mesothelioma can be treated or removed by surgery. It is also based on whether or not the body's lymph nodes are involved. Thank you for watching. This video was produced by Asbestos.Net, a leading resource on all aspects of asbestos and mesothelioma. Our priority is to inform victims about the devastating effects of asbestos exposure, mesothelioma, asbestos cancer, asbestosis, and other asbestos-related diseases, and to advise them with a wealth of information. Individuals whose lives have been touched by mesothelioma have numerous questions and concerns. Their caregivers and family members also need accurate, reliable information. If you or a loved one have been diagnosed with mesothelioma or asbestos cancer and need more information, we invite you to visit and explore the thousands of pages of oncologist-reviewed material on Asbestos.net, to call our convenient toll-free number shown below and speak with a mesothelioma specialist, or to use the simple contact form found at Asbestos.net to request a free copy of our informative books, custom inserts, and DVD. Asbestos.net. Information and help for patients and families.